Welcome to Insight, produced in partnership with Howard University's WHUT. Today we are chatting with Dan Klein, President and CEO of the Patient Access Network Foundation. Dan has generously agreed to share some of his experience with us. I'd like to thank you, Dan, for joining us today.
Well, I'm happy to be here.
So let's talk about affordability of health care and how PAN functions within this marketplace.
Sure. I think PAN is probably the largest foundation that nobody's ever heard of because we play a unique role within the reimbursement system. For people particularly with serious illnesses, high out-of-pocket costs have become a very significant impediment to getting treatment. So patients who may have cancer or chronic diseases like Parkinson's or multiple sclerosis oftentimes are taking specialty medications, and in recent years those medications have started to be covered in ways that leave a lot of cost for the patient to pick up in the form of deductibles and co-insurance. So when we talk about affordability, we have to realize that patients today may have to pay 10, 20, 30% or more of their income just to cover the out-of-pocket costs for their medications. And the burden falls disproportionately on people with serious illness. What PAN does is fill that gap. So basically, we're a stopgap measure, if you will, a safety net for people who need help with those out-of-pocket costs. So someone on Medicare who is most likely living on Social Security, may have a little bit of additional income, could easily end up paying 20% or more of their income without the help that we provide. So we're able to pick up their deductibles and their co-insurance, and they're able to then get the treatment that they need and focus on recovering their health and improving their quality of life.
And you ameliorate this completely unacceptable series of options. You either don't get treated, or you get treated and descend into poverty.
Or you start treatment and can't stay on treatment.
And then you stop treatment, and then you bounce back between health and then dire need, and then recovery, and then
it's a vicious cycle if you can't stay on treatment. We provide assistance for about 60 different illnesses, and people can come to us and request a grant, and we will provide enough funding for them to pay their deductibles and their co-insurance for a full year typically. And the people that we're particularly focused on are those with serious illnesses, because the burden really does fall on them disproportionately. Most people who have Medicare coverage or other insurance coverage who are relatively healthy don't see the high out-of-pocket costs. They may see the high deductible, but unless they're using a specialty medication, unless they're on some kind of long-term maintenance treatment, they may not realize that their insurance is not really adequate. So we're helping those people who are often called the underinsured. And we provide as much funding as we can in these different disease areas. And we still are not able to help everybody who comes to us. So for example, last year we provided about 122,000 grants to patients. And we provided over $500 million in funding just last year.
And you've provided up to $2.6 billion in funding so far.
Since our inception.
Since your inception.
So we've been around for 14 years, and in that time we've provided grants to nearly 1 million people and over $2.5 billion in assistance. So the scale of the problem is daunting, and we're not the only foundation that does this kind of work. There are another 7, 8, 9 foundations that are significant parts of the safety net and do similar type of work to PAN. So, collectively, we still are unable to meet all the need. And that's worrisome because the need is growing. I think what people don't realize is that the number of Medicare patients is growing, and the number of Medicare patients who are exposed to these high out-of-pocket costs is growing.
Plus, in addition to the need growing and the costs growing, you have the fact that how the system functions it seems to embed increasing inefficiencies that are being funded, that are draining some of the resource out of the funders, whether they're individuals or insurance companies or organizations like yours. So that trajectory also has to shift.
Yeah, I think that the complexity in the U.S. healthcare system has added to cost, and we hear a lot of discussion about what's driving up costs in the U.S. compared to costs in Europe or other countries that have good healthcare systems. And in the U.S., the cost is double really what it is per capita compared to other Western European type countries.
What do you think the cause is for that? It seems to me that it can't come from the patients. Patients are just people, and people across the world have similar issues. So it can't be a patient issue. It can't be that we have greater level of disease here in this country. The doctors are no better or worse than other educated, well-informed physicians. What is going on?
What's different is the way healthcare is financed in the U.S. And we have a very complicated system with lots of middlemen, and everybody is getting paid along the way. So that's one of the reasons costs are higher in the U.S. is just the administrative complexity is greater.
It's the market inefficiencies. It's the actual friction that we've built into our system.
That's one good way of describing it. Yeah, and you don't have that in systems where there are fewer intermediaries in the reimbursement process.
But so you have a background in information technology as well. Isn't the free market about reducing friction? It's about creating the ability to have responsiveness. Why is the market not responding in ways that reduces this friction? How come we seem to have layer upon layer upon layer and all these intermediaries, as you point out, or all these administrative costs? It would seem that there should be some ability to disintermediate and to create a more direct relationship between the various players and then to eliminate those.
Well, I think there are efforts in that direction, but so far, it hasn't really paid off. I think that we'll see more experiments looking at ways to make the system more efficient. But we're in a different political system. There's reluctance to go in the direction of a single payer, which would simplify the administrative complexity. And there is also a need in this industry to have regulation. So you're balancing the free market against regulation, and you also have a lot of concentration of control. So there's been a lot of consolidation in the industry. So you don't really have a perfect market, and the idea that you have a frictionless free market just isn't easy to achieve within the healthcare sector. There's always going to be a need for regulation, and there's going to always be some friction that's required to keep patients safe and to make sure that the quality is high. That said, obviously other countries have found ways to reduce the administrative costs. And another driver, certainly here is probably related to the cost of medications. There's been a lot certainly in the news about that. And the U.S. is a little different than other countries in that it doesn't use health technology assessments or other techniques to try to put pressure downward on the costs of very expensive drugs.
And how am I likely to come into contact with PAN if I am a person in need?
So generally, it's pretty easy to come to PAN and get a grant. It's about a 10 to 15 minute long process. So while you're actually talking to our call center or online with the web application, we'll tell you immediately whether your grant's approved. So, and you can use that right away. You can take that to your pharmacy immediately and fill your prescription.
So if you could shape the healthcare system, but we're restricted in terms of, well, let's just reduce the costs, right? How would you reshape how you interacted with the system that provides healthcare, but at a cost that is too high, with
Right.
too high deductibles, so that you were less necessary as an organization?
I would like to be unnecessary as an organization. So PAN is a imperfect solution, and foundations like PAN. We really shouldn't exist if the healthcare system was doing what it needs to be doing in the way of providing affordable access to critical medications. There wouldn't be a need for us. So we would recommend three things in Medicare. One, we would recommend trying to find a way to spread the out-of-pocket costs more evenly throughout the year, so it's not hitting all in January or in February. Two, we think there needs to be some kind of out-of-pocket limit so that patients aren't exposed to an unlimited amount of cost. And the third thing is to try to look at whether there are some ways to shift money, so that patients who are seriously ill within Medicare aren't being disproportionately affected. The situation at hand is that PAN and similar foundations provide a critical safety net for patients who are seriously ill, and there is no alternative right now available to those patients. So while I look forward to a time when the healthcare system is reformed and addresses this problem more directly, we will do our best to be here to help those patients who need the help that we provide.
Well, Dan Klein, thank you so much for describing the work of the Patient Access Network, and thank you so much for your insights.
Well, thank you very much.